Informed consent is a fundamental ethical and legal principle in healthcare, particularly critical in behavioral health settings. It embodies the respect for client autonomy, ensuring that individuals are fully aware of and agree to the care they receive. In behavioral health, where interventions often involve personal and sensitive issues, informed consent is a cornerstone of trust and collaboration between clients and providers. This chapter explores the definition, purpose, and implementation of informed consent in behavioral health, emphasizing its role in promoting ethical practices and empowering clients in their recovery journeys. Defining informed consent. Informed consent is the process through which clients are educated about the nature, benefits, risks, and alternatives of a proposed intervention or treatment. It is not merely a formality or a signed document, but an ongoing dialogue that ensures clients understand and voluntarily agree to their care. Key components of informed consent. 1. Disclosure. Clients must be provided with comprehensive information about the proposed treatment, including purpose and goals, procedures and interventions, potential benefits and risks, alternatives, including the option of no treatment. 2. Comprehension. Information should be presented in a manner that the client can understand, taking into account their language proficiency, cognitive and emotional state, educational background. 3. Voluntariness. Consent must be given freely without coercion, pressure, or undue influence. 4. Competence. The client must have the capacity to make informed decisions, which may require evaluation in cases of cognitive impairment or mental health crises. 5. Documentation. While verbal consent is valid in some cases, written documentation is often required to ensure clarity and accountability. What is the purpose of informed consent? The purpose of informed consent extends beyond legal compliance. It serves as a mechanism to empower clients, enhance therapeutic relationships, and uphold ethical standards in behavioral health care. 1. Promoting client autonomy. Informed consent respects clients' right to make decisions about their own care. By providing detailed information, clients are empowered to make choices aligned with their values and preferences, set boundaries, and define their role in the therapeutic process, take ownership of their recovery journey. 2. Building trust and collaboration. A transparent, informed consent process fosters trust and collaboration between clients and providers. Clients who feel respected and informed are more likely to engage actively in treatment, share concerns and feedback openly, develop a stronger therapeutic alliance. 3. Ensuring ethical and legal compliance. Behavioral health professionals are bound by ethical guidelines and legal requirements to obtain informed consent. These obligations are outlined by organizations such as the American Psychological Association, APA, the National Association of Social Workers, NASW, the American Counseling Association, ACA. Compliance reduces the risk of ethical breaches and legal disputes. 4. Enhancing treatment outcomes. Clients who understand and agree to their treatment are more likely to adhere to care plans and therapeutic interventions, experience increased motivation and engagement, achieve positive outcomes in their mental health and well-being. What is informed consent in behavioral health contexts? The application of informed consent in behavioral health involves unique considerations due to the nature of mental health and substance use treatment. 1. Sensitivity to stigma. Behavioral health clients may face stigma related to their conditions. Providers must create a non-judgmental environment, address concerns about confidentiality and disclosure. 2. Complexity of treatments. Behavioral health treatments often involve psychotherapy techniques, which may have varying outcomes, medications with potential side effects, group therapy dynamics, which require clear boundaries and expectations. 3. Vulnerable populations. Special considerations are needed for clients who may have cognitive impairments, severe mental health crises, limited legal capacity, e.g., minors or guardianship cases. 4. Cultural competence. Effective informed consent requires awareness of cultural and linguistic differences, use of interpreters or culturally adapted materials when needed. What are the challenges in implementing informed consent? While informed consent is a cornerstone of ethical practice, its implementation can face challenges in behavioral health settings. 1. Communication barriers. Clients may struggle to understand complex medical or psychological terminology. Providers must simplify language and avoid jargon. Use visual aids or analogies to explain concepts. 2. Time constraints. High caseloads and limited session times may pressure providers to expedite the consent process. This can compromise the depth of discussion, lead to misunderstandings or incomplete consent. 3. Client capacity. Clients experiencing acute distress or cognitive impairments may have limited ability to comprehend information. Providers may need to postpone non-urgent decisions, seek input from family members or legal representatives. 4. Cultural and systemic barriers. Systemic factors, such as lack of access to interpreters or culturally sensitive materials, can hinder the consent process. Addressing these barriers requires systemic advocacy and organizational support. What are the best practices for informed consent? To ensure informed consent is meaningful and effective, behavioral health professionals can adopt the following best practices. 1. Foster open communication. Encourage clients to ask questions and express concerns. Reassure them that their input is valued and will guide the treatment process. 2. Use accessible materials. Provide written materials that are clear, concise, and tailored to the client's literacy level. Consider multimedia tools to enhance understanding. 3. Verify understanding. Use techniques like the teaching back method, where clients summarize what they have learned to confirm their comprehension. 4. Document thoroughly. Maintain detailed records of the consent process, including discussions, questions, and signed forms. This ensures accountability and clarity. 5. Adapt to client needs. Be flexible in the timing and approach to informed consent. Adjust for crisis situations requiring immediate interventions. Long-term therapies where consent may need to be revisited periodically.
Hey everyone, this is Jay Ferg, and in this video I'm going to talk about one of the most important ethical and legal requirements in modern medical care: informed consent. In my last video, I shared the story of Martin Salgo and the first time the term informed consent was used publicly, but now I'm going to get into the details of informed consent itself. In general, informed consent is when a patient voluntarily agrees to a proposed medical intervention or treatment after being reasonably informed about said intervention or treatment. Valid informed consent has 3 requirements. First, it must be voluntary. Second, it must be informed. And third, the individual must be capable of giving their consent. I'm going to start with the easiest one first. A patient's consent must be voluntary. It cannot be forced, it cannot be coerced, and it cannot be manipulated. Consent must be given freely. Second, consent must be informed. A patient must have enough information to make a good decision. This part gets a little bit tricky. There isn't an algorithm to determine what is considered enough information. As one would expect, every patient has a different level of knowledge coming into an appointment, and many treatments or interventions have different factors that ought to be stated or emphasized. In each individual case, more or less information may be required, and different details may need to be pointed out. While there isn't an explicit method, it is typically understood that a healthcare professional has adequately informed a patient if the patient has been given as much information as a reasonable person would need to make the decision under similar circumstances. Using that standard in the broadest sense, it's safe to assume a patient needs more information than just being told that the treatment is good, but likely doesn't require so much information that the entire appointment is spent reading 20 years of research papers. A helpful introductory guide of information that a reasonable person would need consists of the nature of the treatment or intervention, the expected benefits, the risks and side effects, the likely consequences of not having the treatment or intervention, and any alternative courses of action. So if someone goes to see their doctor about a flu vaccine, the patient needs to know it's an injection, that it will help prevent the flu, that the common risks are some aches and pains as well as some soreness around the site of the injection, and a rare risk of Guillain-Barré syndrome. They need to know that if they don't get the flu vaccine, they will be more likely to get the flu, and there might be alternative options to the injection, like a nasal spray. From there, unique attributes of the case ought to be addressed. Perhaps the treatment is very new, and the risks and side effects are poorly understood. Perhaps the intervention is not covered by insurance, but a less effective option is. Details such as these, as well as answering any questions the patient may have, need to be brought up because they are important for the patient to make their decision. Finally, a patient must be capable of giving consent. This means the patient must understand the information they have been given. Informed consent is not valid if the patient has been told all of the relevant information but didn't understand a word they were told. The patient must also be able to appreciate the reasonable foreseeable consequences of their decision or lack of decision. They need to be able to use the information they were given to balance the risks and benefits of their choice. There are different ways of assessing and addressing capacity depending on where you are, but I'm going to get into that in my next video. So those are the 3 requirements for obtaining informed consent. It must be voluntary, it must be informed, and the patient must be capable of giving their consent. In addition to the aforementioned 3 points, it is important to recognize that obtaining consent is an active process. It requires careful consideration and judgment throughout the course of treatment. Since informed consent is voluntary, a patient can change their mind at any time. Since informed consent relies on a patient being informed, they need to be kept up to date with changes or new information that's relevant to their treatment. And since they need to be capable of giving their consent, any changes in capacity need to be taken into consideration as well. To learn more about a patient's capacity to give informed consent, please stay tuned for my next video. Thank you very much for watching, and if you like this video, please subscribe to the channel to learn more about what the hell is bioethics.
Informed consent is more than a procedural requirement. It is an ethical commitment to respect and empower clients in behavioral health. By ensuring clients are informed, understood, and actively involved in their care, providers can foster trust, enhance treatment outcomes, and uphold the highest standards of professional practice. As